Hello and welcome to this educational video. Diabetes is a very common health problem in India. So how do you treat diabetes? Main thing is you have to give drugs, medication to the patient so that the blood sugar level is under control. So it could be in the form of pills or it could be in the form of insulin. So it's not enough if you just give the patient drugs for management of diabetes. So you have to have other support system to help the patient. So this could be in the form of maintaining a strict diet that is compatible with the blood sugar level. You should also prescribe exercises. It could be running, walking, swimming, sports, etc. And also you should introduce things which will help take care of the stress of the patient. It could be yoga, it should be counseling or music. So for management of a particular disease condition, it should be a combination of so many factors in which diet or exercise will be one component and medication will be another component. This kind of a combined approach is not only restricted to conditions such as diabetes, it is also applicable to one of the important neurological disorders called as Parkinson's disease. So today we will be discussing about lifestyle modifications that are required for Parkinson's patients. So we have with us our expert Dr. Ravi Yadav, who is working as Professor of Neurology in NIMHANS. He is also an expert in the field of movement disorders and Parkinson's disease. Namaste Doctor, and welcome to this program. So there is a lot of information about different kinds of drugs, medications, treatment, surgical options for Parkinson's, and I know little information that apart from this we need much more to make sure that there is optimal treatment regimen for a patient. Can you just elaborate on that?
As you rightly said, tablets, injections, as well as the newer modalities of surgery, and all are used for treatment of Parkinson's disease. But you know that the pathology or the disease is in the brain, and the number of dopamine cells are going down.
Yeah.
So it has always been thought and for the researchers how to halt this progression of disease.
Correct.
So various methods have been tried. For lot of them evidence is there, not there. And then you are also aware that there are non-motor symptoms like depression, anxiety, memory impairment, constipation, which also form a large group of symptoms which also create problems for patients with Parkinson's disease. So to counter this, apart from the medications, there are various lifestyle measures which are very important. And now there is enough scientific evidence to say that these measures are also very useful for the overall improving the life of the patient with Parkinson's disease. So briefly I will touch upon quickly one by one. So for example, to begin with, it is always the food, what kind of food is taken. And so food wise, if we say patients have with Parkinson's have constipation, we know that they have constipation, bowel movement is slow. So the kind of diet which is needed is which will improve the roughage content and bulk of the stool. So more of salads, green vegetables, and plenty of water, because in our country, because of the warm climate,
weather, correct.
the amount of water intake should be adequate. So water intake and
Water intake
adequate
and more of
fruits,
vegetables
fruits
and
and
fruits
vegetables.
okay, so that it will improve the bowel movement.
Bowel
Okay,
movement.
okay.
Then comes also the fruits, the colored fruits, which contain antioxidants.
Okay.
For whatever reason there is no clear evidence, but still overall the antioxidants improve the vitality of the cells in the body. So in that way,
okay.
they would also help the brain cells. It will maybe neuroprotective also.
Okay.
So that the cells degeneration may be slow.
So neuroprotective means they are sort of safeguarding the cells.
Yes.
So the antioxidants will help improve the safety of the cells in the brain, or they'll protect the cells.
Exactly.
Okay.
So vitamin C, vitamin A, all these are, and vitamin D, which is a very important component which is required in the body, is manufactured in the sunlight.
Correct.
As we all are aware, and lot of literature is coming up that vitamin D improves the overall well-being, immunity of a person, joints, muscles.
Correct.
So patients with Parkinson's who have vitamin D deficiency will be more prone for pain and osteoporosis. So there should be adequate sunlight exposure
to sunlight. Okay.
So around 10 to 15 minutes daily sunlight exposure in the morning or in the evening sunlight, not in the afternoon. Obviously.
Correct.
So that will be very useful to improve the overall well-being, and it also helps to maintain the circadian rhythm, sleep rhythm. So if morning sunlight exposure will provide vitamin D as well as maintain the circadian rhythm, and prevent insomnias and pains and aches different types. Then comes the third part, which is the different type of exercises which are told.
Exercises, okay.
So now the exercises, various therapies have been tried, and to begin with I should tell you that as of now the literature is very robust, that only strong exercise, there is a protocol which has been found, can actually slow down or even improve the progression of Parkinson's disease.
Okay. Sorry, before you go, I have one question. See, basically the function of the movement is impaired. Yeah. So how free are the patients to actually do these exercises? Of course, this has to be done under supervision, because they might not be able to attempt at all the exercises.
Absolutely. Okay. So there are a set of exercises which are to be done. It is not based on the individual's capacity. So the person, the physiotherapist or doctor will advise what all can be done based on the heart problem, and if there is any joint related issues. So it will be individualized.
Okay.
But overall, if the patients are diagnosed early stages, and if they start early exercise, then the chances of developing all these other skeletal problems also will become less.
Okay.
So that way, then there are various groups. For example, indigenous India yoga and all, you can have a separate program for that. Then the Tai Chi has been found, and then brisk walking, individual body movement related exercise, because you know that in Parkinson's the movements are less.
Correct.
There is chance of developing shoulder arthritis, neck pain, joint pains. So mobility improvement exercises.
But that makes me ask one question. See, I also heard of this physiotherapy.
Yeah.
So do you think physiotherapy is also one option for people who are not able to?
So if
move,
a good physiotherapist will tailor the exercises based on the patient's condition and his skeletal problems, heart condition and all, based, and slowly will take it to a next level. So but overall help, it is like a person seeks help from physiotherapist, but then ultimately if he does it himself, so that is much better.
But in general, what you are saying is, now it's a combination of everything. You have diet, and you are also listed few things that should be included in the diet. Then you have exercise, and these things should be, of course, done in moderation and under supervision. I had one question about this diet especially. So the regular diet can be taken, and apart from that, you are asking to increase the greens or salads or
So
is it
also in diet, one important precaution has to be there, that the absorption of main drug levodopa
okay.
is has a competition with protein in the diet. So we always
okay, okay.
advise the protein, the lunch, dinner, and spacing out between the dose of levodopa, carbidopa, that is, and the food. So at least 1 hour before we ask the patient.
Okay, so that the medicine is absorbed.
Yes.
And then only you can take care of your food.
Yeah. So if the tablet is taken with the food, the absorption and desired effect does not happen.
Okay, that has to be
So
considered.
but then and people go on thinking that the drug is not working. So carefully, there should be a gap between a diet should. It is not necessary to reduce the protein or reduce the, but there should be adequate spacing between them.
Okay. One more thing, doctor. Actually, do you think just by exercise or diet itself in the early stages, for example, if a person comes to know that he is in the early stage of Parkinson's, do you think you can use robust exercise and diet, this thing, and antioxidants, so you can maybe reduce the drug or?
So you very nice question. Actually, young onset Parkinson's patients go for this. Many of my patients are doing very well on different kind of exercise, badminton, running, cycling, swimming, those who can do.
Correct.
And their requirement of medication is less as compared to the patients who do not do exercise and become obese in this and develop various other non-motor problems. So they definitely do very well. Those who
and also this kind of physical activity will also improve their outlook towards life. You know, they will have a positive attitude towards life, and for some time they will be forgetting about all those problems. And
so it gives multiple benefits in the form that there are endorphins, enkephalins which are secreted in the brain.
Correct.
Of a person who does exercise, so they give a feeling of well-being.
Correct.
Then they have mobility improves, the strength of the muscles improve, so the sleep improves. So overall, there is multiple benefits, and then neuroprotection is one which is now significantly acknowledged everywhere, that it improves the survival of the neurons also.
Okay. So that's very good information. Actually, people mainly focus on medication and drugs and surgery, but if you have optimal combination of that along with whatever you said, that will be very ideal way of approaching this. So maybe in a couple of sentences, if you can summarize for the benefit of viewers the key features of whatever we discussed.
So what we discussed today was that basically diet and exercise, if the modifications are started early, immediately after the diagnosis, then they carry very big implications in the form of delaying the requirement of high doses of medications, and also avoiding non-motor symptoms, depression, anxiety, joint problems, muscle weakness, constipation. All these can be managed significantly by just altering the diet and this exercise itself, which you have to consult your person has to consult their
it should correct under supervision only. Nobody should do any
individual capacity is different.
Exactly.
Their heart condition, joint. So suitable options are available based on whatever is feasible to a person.
Okay. Thank you, doctor. Thank you for providing information, valuable information to patients about how other factors, lifestyle modifications could help improve the life of a Parkinson's patient. Thank you. Namaste.
Namaste.